All right, everyone, buckle up for a deep dive. But this one's a little different. We're tackling a medical mystery, but it's fictional. Think choose your own adventure for infectious diseases. We've got Marsha's case files. And oh boy, it's a real page turner. So imagine this, 20-year-old university student, just back in the U.S. after a medical internship in Nigeria, decided to be home.
Yeah.
But things take a turn. She starts feeling, well, not great.
What's interesting here is that those first symptoms are super common, like fatigue, that nagging cough. Anyone could just dismiss it, right?
Yeah.
Oh, just a bug she picked up traveling.
Exactly. Totally misleading, though, because weeks go by, and for Marsha, it just gets worse. The fatigue is relentless, no appetite, and a low-grade fever. Turns into a full-blown inferno, night sweats, the whole 9 yards.
Oh, wow.
And then there's the coughing up blood.
Yeah.
And these weird whitish clumps, too. I mean, it's straight out of a medical thriller.
Yeah, that coughing up blood, hemoptysis it's called. And that sputum, especially with that cottage cheese look, those are serious red flags. Not your run-of-the-mill cold symptoms. Definitely points to a nasty respiratory infection, something more serious.
Weeks of this, and Marsha finally sees a doctor. Good move, right?
Yeah.
The doctor listens to her lungs, hears a crackling sound. Not exactly what you wanted a checkup.
Yeah.
So they order a chest x-ray, and they get a sample of that, concerning sputum.
This is where the real detective work starts.
Yeah.
Chest x-ray shows cavities, literally holes in her lung tissue. There are these opacities, too, denser areas on the x-ray.
Yeah.
And the way it's all spread out, not normal at all.
Yikes. That's scary.
Yeah.
So remember how Marsha was in Nigeria? That's key. The doctor starts thinking about diseases that are more common over there. And one big one pops up, tuberculosis or TB.
Makes sense, doesn't it? She's working in a medical lab in Nigeria. Could have been exposed to Mycobacterium tuberculosis, the bacteria behind TB.
It's like the doctor's putting a puzzle together, right? Using all the pieces. Her symptoms, the x-ray, her travel history.
Exactly.
So strict treatment plan. Home isolation for Marsha. She has to wear a mask to prevent spreading anything. And told to take a semester off school. Oh, and she's got to take this cocktail of antibiotics, isoniazid and rifampin, 3 times a day for at least 3 months.
This is really important for TB treatment. Isolation that prevents spreading the disease, the mask helps too. Rest is crucial, of course, to recover. And the antibiotics, they're going after the Mycobacterium tuberculosis itself. But why so long on the treatment? Well, because M. tuberculosis is really slow growing, like stubborn to get rid of.
Wow. So while Marsha's home fighting this potential TB, the lab's busy analyzing her sputum sample. And under the microscope, they find acid-fast bacteria.
That's a huge clue. Acid-fast bacteria. Their cell wall is unique. It doesn't stain with the usual lab methods. That's a classic sign of M. tuberculosis. Makes it harder to treat, too. That cell wall. It's like a fortress, shielding the bacteria from some antibiotics. But it also helps us pinpoint what we're dealing with.
So it's a good thing A and D a bad thing?
Yeah.
They try to grow the bacteria from the sample, but nothing for a whole week. It's like watching paint dry.
That slow growth. Another M. tuberculosis hallmark takes its sweet time, which delays diagnosis. But then, after 4 long weeks, colorless granulated colonies pop up. And you know what? Those colonies, full of those same acid-fast bacteria they saw under the microscope.
The plot thickens. They do some fancy tests on those colonies. Nucleic acid hybridization and direct nucleic acid amplification testing, or NAA.
Oh, these are really specific, super sensitive tests, like getting a fingerprint, but for bacteria. We can look at its genetic material and know for sure what it is.
So the tests show the bacteria belongs to the Mycobacteriaceae family. The acid-fast guys, right? But to be extra sure, they do DNA sequencing on certain parts of the bacteria's DNA, and they find a high G plus C content.
That high G plus C content, it's the final nail in the coffin. It confirms 100% that what's in Marsha's sputum is Mycobacterium tuberculosis. We found our culprit. Whew, finally got a diagnosis. Like solving a medical puzzle, isn't it?
Yeah, for sure. So we know it's TB, but the big question is, does Marsha get better? After all those weeks, the isolation, those intense meds, did it work?
Here's the good news. She did. After 9 months sticking to the doctor's orders, the whole shebang, Marsha fully recovered. It's a testament to modern medicine, but also to patients really sticking with their treatment.
9 months is a long time, though, especially for someone in their 20s. It really shows how serious TB is and how important it is to follow the treatment no matter what.
It really does. Marsha's case, it's like a textbook example of why patient education matters. Imagine if she hadn't understood how important finishing all those antibiotics was. Maybe she stops early, feels better, thinks she's in the clear, but then, bam, the infection comes roaring back. Maybe even worse, maybe even drug resistant. Scary stuff.
It makes you appreciate how strong you got to beat something like TB.
Yeah.
This whole deep dive, though, it's been a reminder about paying attention. We started with these basic symptoms, but each step, each test result revealed more clues, and it all led to the right diagnosis.
It's pretty amazing, isn't it? One case, like Marsha's, can show us the whole diagnostic process. The travel history matters, those little details, and using everything. The exam, the imaging, the lab tests, it's all connected.
A detective story, but with a tiny bacteria as the culprit. Speaking of culprits, though, we've focused on Marsha. But what about TB on a bigger scale, globally, I mean?
Good point. TB might not be a huge deal in the US, but in tons of other countries, it's a major health problem. Millions affected every year. It's one of the top causes of death from a single infectious agent, especially in those lower income countries.
Yeah, health problems don't just stay put, do they? Marsha's story had a happy ending, but it makes you realize we need more research, better access to healthcare, global teamwork to really fight TB.
Totally agree. We need faster, more accurate diagnostic tools that are easy to use, especially in places with limited resources. And better drugs, ones that can tackle those drug-resistant strains of TB that are popping up more and more.
It's a fight on all fronts, isn't it? Understanding the science behind Mycobacterium tuberculosis, but also those public health strategies to stop its spread. Marsha's case, even though fictional, it gives us a look into how complex this disease is and how tough it is to control.
It reminds us that we've come a long way in fighting TB, but there's so much more to do. And it's not just about a cure. We have to address those social and economic factors that help spread the disease. Poverty, not enough food, bad housing.
So what can we do, like as individuals, to help fight TB? I mean, besides getting tested ourselves if we have those symptoms.
Awareness is key. The more we know about TB, the better. Symptoms, how it spreads, how it impacts the world, then we can actually push for change. Support those organizations fighting TB here and abroad. Learn about prevention, early detection, and teach others. And push for policies that make global health a priority so everyone gets good health care.
It's mind-blowing that something so tiny, a bacterium, can cause so much trouble worldwide. What is it about Mycobacterium tuberculosis that makes it so tough to beat?
Well, like we talked about, that weird cell wall, it's a big factor. Super resilient, hard to treat with the usual antibiotics. But there's something else about M. tuberculosis that's interesting. It can go dormant.
Dormant, like it takes a nap and waits for the right moment to come back.
Exactly. M. tuberculosis can actually kind of hide out in the body. It's not actively doing its thing, causing disease, It can stay hidden, sometimes for years, before it reactivates and symptoms start up again. Sneaky. So even if someone's treated for TB, recovered, it could still come back.
It's possible, especially if their immune system gets weak for some reason. That's why the research is so important. Scientists are trying to develop new drugs, ones that can target both active and latent TB, and they're looking for ways to boost the immune system, help it fight off the bacteria better.
Sounds like we're just starting to understand this bacteria. This deep dive's really shown me how challenging TB is. But it's also made me curious about all those other infectious diseases out there. Where should someone go to learn more about that stuff?
Oh, there are some great resources if you're interested in infectious diseases. The World Health Organization, the WHO, their website is packed with info. Up-to-date data on TB and other global health problems. The CDC, the Centers for Disease Control and Prevention, is awesome too, especially for stuff in the US. And if you really want to dig into the research, there's PubMed. It's a free search engine. You can access tons of biomedical articles. Awesome. We'll definitely put links to those in the show notes. So as we wrap up our deep dive into Marsha's fictional medical mystery, what's the one big thing you hope listeners take away from all this?
I think the biggest thing is knowing is half the battle. The more we understand about infectious diseases, the better. How they spread, how they mess with our bodies, how we treat them. That knowledge helps us protect ourselves and our communities. And part of that is knowing about global problems like TB and speaking up for solutions that tackle those challenges worldwide.
Couldn't have said it better myself. To our listeners, if this deep dive got you curious about infectious diseases, keep learning. There's a whole world of fascinating stuff out there. And remember, stay curious, stay informed, and stay healthy.